We will now discuss the needs of a child with type 1 diabetes in the school setting. The purpose of our presentation is to identify the needs of a student with diabetes, to assist you in working together with the parents to manage diabetes in the school setting. Our learning objectives are: what is diabetes, hypoglycemia or low blood sugar, hyperglycemia or high blood sugar, blood glucose monitoring, insulin, nutrition and diabetes, and the role of the teacher, parent, and student. School-age students with diabetes spend 30 to 35 hours a week in the school setting. This represents more than half of their waking weekday hours. School personnel who are knowledgeable in diabetes care can increase students' and parents' satisfaction with the educational experience. 1 in 300 children from birth to 18 years have type 1 diabetes in Canada. Starting school is an exciting rite of passage for most children. For parents of children with diabetes, it is an extremely stressful time. Parents worry, will my child be safe? Will the school know how to treat a low blood sugar?
What is diabetes? There are two types of diabetes, type 1 diabetes and type 2 diabetes. For the purpose of this presentation, we will be focusing mostly on type 1 diabetes. We will introduce type 2 diabetes. Type 1 diabetes is a type of diabetes most commonly seen in children. It is an autoimmune condition that over time destroys the cells in the pancreas that make insulin. When 80 to 90% of these cells that make insulin have been destroyed, the body will no longer have enough insulin and the blood glucose will rise. The only way to treat this type of diabetes is by giving insulin. Insulin is a hormone that helps our body use the energy from the food we eat. Insulin is essential for survival and must be given multiple times each day. Blood glucose monitoring guides the parents in determining the insulin dose. When there is not enough insulin, the glucose cannot get into the cells and the cells are starved for energy. When this happens, the body then uses fat as an alternate source of energy. The body tries to correct the high glucose by making you thirsty, which in turn makes you urinate more often. The use of fat for energy causes weight loss. These are the classic symptoms of type 1 diabetes: excessive thirst, frequent urination, and weight loss. If untreated, it can lead to a condition called diabetic ketoacidosis, which is serious and requires immediate medical attention. For a child already diagnosed with type 1 diabetes, high blood glucose is a concern if the child is also feeling sick, for example, nausea, vomiting, abdominal pain, because this may be a sign of impending diabetic ketoacidosis. The parent should be called in this situation. Type 2 diabetes usually develops in adulthood, but in recent years it has been diagnosed in children and teens. With type 2 diabetes, the body does not produce enough insulin or use the insulin it produces effectively. Unlike type 1 diabetes, type 2 diabetes does not always require insulin and can often be managed by diet and exercise or the addition of oral medication. In some cases, insulin will be required. Blood glucose monitoring may be required less often in type 2 diabetes. Diabetes management is a balancing act. The treatment of diabetes can be viewed as a balance. On one side, food and stress increase the amount of glucose in the blood. On the other side, exercise and insulin lower blood glucose levels by allowing glucose to be used for energy. Children with diabetes must test their blood glucose frequently to monitor this balance. There are many variables that can affect blood glucose. Sometimes events can make blood glucose go high or low. It is essential to monitor blood glucose to determine the effect of these things on the blood glucose. For example, sports may lower blood glucose and stress may make the glucose rise.
Blood glucose monitoring. The learning objectives are: why blood glucose monitoring is necessary, when blood glucose should be monitored, and the teachers' and parents' responsibilities. Why monitor? The goal is to maintain blood glucose within the target range for the student. The immediate benefits are to identify, treat, or prevent a high or low blood glucose. The challenge is that many variables impact blood glucose. It is difficult to completely avoid high and low blood glucose. This is a demonstration on how to test a blood glucose. The equipment that we have is an alcohol swab to clean the finger, the blood glucose meter, the test strips for the meter, and we have 2 lancing devices. The first lancing device has the lancets preloaded in a drum. The second lancing device, you must insert a lancet before doing your blood glucose test. You would now remove the strip from the container, the test strip, and insert it in the blood glucose meter. This turns the meter on, and you would clean the finger with an alcohol swab prior to doing the poke for the specimen. Once that is done, you would use your lancet to obtain the specimen, and then apply a drop of blood to the test strip which is in the meter. Once the blood has filled the channel on the test strip, the meter will read the blood glucose and display it on the meter screen. When the test is complete, you may remove the test strip and discard this and record the blood sugar in the child's logbook. There are many different meters on the market. This is just a sample of 1 meter. Blood glucose is monitored before each meal, at bedtime, and at other unscheduled times such as changes in activity, confirming a low blood glucose, assessing the treatment of a low blood glucose, and at times of illness when more frequent monitoring is necessary. The routine testing assists the parents in insulin adjustment to keep the blood glucose within the target range. Each age group has an ideal target glucose, but it is often individualized for each child. There are many variables that affect blood glucose, and therefore it is very difficult to maintain all tests within the desired range. For any student receiving insulin, there will be times when the blood glucose is higher or lower than the target. The important thing is to have a plan for management of these readings when they are outside the target range. There may be required testing before gym class, any new physical activity, or a change in the daily school routine, such as early dismissal or sports days. If the student states he or she has a low blood glucose or is feeling unwell, the blood glucose should be monitored. If the teacher suspects the student may be having a low blood glucose, it should be monitored. What does the number mean? There are target blood glucose ranges for each age group. Students starting school and under age 13, the usual target is 4 to 10 before a meal, but this may vary throughout the day, and as we have already stated, some students have individualized targets due to unforeseen circumstances. Treatment is needed if the blood glucose is less than 4.0 on the meter, or if the child is having symptoms of a low blood glucose. The blood glucose result may be influenced by the time of day. For example, if testing after a meal, the blood glucose may be higher. If testing when the insulin is peaking or during an activity, the blood glucose may be lower.